Very good. Well, good morning, everybody. Good afternoon, good evening, which part of the world you are in today. First of all, I'd like to thank everybody for this great opportunity to be a speaker on this symposium. Oops, alrighty, that's a good issue. My name is Humberto Matos. I'm a doctor of acupuncture and internal medicine. I'm licensed acupuncture in the state of Rhode Island and Portugal as well. I've been studying Chinese medicine since 2002. My education was based on 3 different countries: Portugal, Canada, in the United States, where I completed a doctoral program at 5 branches university. My clinical practice is a very diversity practice. It comes from private practice, community acupuncture, on board cruise ships to hospital settings as well. I encountered the acupuncture in the Province VA Medical Center. And today I'm going to present on a case study on acupuncture for diabetic peripheral neuropathy. So let's understand a little bit, what is diabetic neuropathy? So it is a painful disorder affecting 70% of the population with diabetes in the United States. Back in 2020, there were more or less 32 million people diagnosed with diabetes. So that brings to an average of 22 million people in the United States have peripheral neuropathy, which is a substantial increased number. So let's take a look at just a general review. What is diabetes? It is a disease that's caused by having high levels of glucose in the bloodstream. The pancreas secretes insulin into the bloodstream to transport the glucose from the cells, from the blood to the cells to be used as energy. In other words, our body depends on glucose, has a source of energy, same way that cars require gasoline to function. Our body requires glucose. So what happens when people develop diabetes? So when the body fails to transport glucose into the cells, it leads to a high level of sugars in the bloodstream. Over a long period of time, having high levels of blood sugar on the blood, it tends to damage nerve structure and blood vessels over a period of time. So this is something gradual, nothing fast onset. Once the nerve is damaged, it causes constant firing of the nerve cells, causing frequent pain. So let's take a look at the cost of diabetic neuropathy. So it is estimated that 50% of people with diabetic neuropathy are asymptomatic, which make very difficult to diagnose. And this I found very common within my practice and talking to different colleagues, because at a certain point, people start dragging their feet on the feet, tripping, falling, and they usually attribute that as an old age. But in all honesty, that could be early signs that they have neuropathy and they're not aware of it. 20 years ago, the cost of diabetic neuropathy, its complication, was 4.6 to 13.7 billions in dollars. So going forward 20 years, one can estimate that the cost has increased. Again, if it doesn't treat early, then it can lead to complications as foot ulcers and amputation. So patients who are diabetic have a slower healing response. And on an average, up to 43% of patients tend to miss 5.5 days of work per month. So having a great socioeconomic impact on the company, on the patient as well, the person, because they will be able to earn income to support himself and the family. So let's focus on the diagnosis of peripheral neuropathy. So basically, through family history, medical history, the most important physical exam of the foot, some neurological exams of the foot, but common practices like a tuning fork in the toes or a monofilament test to check for foot sensation. It tends to affect their quality of life, physically and mentally causing anxiety, depression, and tend to affect their sleep. There's a lot of patients say they're not able to tolerate even the bed sheets touching their feet, so they're not able to have a good quality sleep. Same thing on physically, affecting the ability to walk, become more unstable, and again, increases the a risk of falling, which, again, diabetic patients have a harder time healing. So last thing they need is an injury that takes a while to heal. Usual care for diabetic neuropathy relies mostly on medications, antidepressants, anti-seizure medications, opioids, again, follow-up care, prevent ulcers, and care for ulcers. Now we're going to talk about diabetes from a Chinese medicine point of view based on the classics. During the spring autumn warned state in Han Dynasty, Suen chapter 47 probably gives the oldest description of diabetes. It was known as Chiaka syndrome, known as wasting and thirsting. It is first mentioned in Suen chapter 47 as a result of ingestion sweet and fatty food. Then we know that sweet and fatty foods have a high glycemic index, so causing a spike on the blood sugars. During the Jing, Sui, and Tang dynasties, physicians add longevity elixirs and alcohol as a cause of Chiaka syndrome. So we know some longevity elixirs most likely have some either honey, some sweet herbs, alcohol, again, empty calories that increase the chance of patients developing Chiaka syndrome. Maybe during this period, everybody wanted to be immortal, so using longevity tonics. Interesting, one of our great ancient physicians, Sun Sun Miao, prohibited the use of acupuncture and moxibustion with patients with Chiaka syndrome to avoid infections. So most likely, Sun Sun Miao observed on his practice that patients that had Chiaka syndrome had a hard time healing. So that's the best way to prevent from developing into more chronic or serious condition. During the Song, Jing, and Yuan dynasties, physicians observed that patients with Chiaka syndrome could become deaf, blind, and develop ulcers. We know that people with uncontrolled diabetes can become deaf and, again, affect different structures of the body. So another interesting statement from the Asian classics that, based on their observations, they're able to document this. During the Ming and Qing dynasty, the physicians observed gangrene development in the lower extremities was a poor prognosis. Again, we can confirm that with modern medicine that gangrene correlates with stomach infection and cause the patient to die unless the limb gets amputated. Going forward to modern Chinese medicine, using complete blood panel to diagnose diabetes and be able to manage the blood sugar levels. So going back to the class again on the cause of pain, on Ling Chu chapter 27 describes that pain is a result of the strict flow of qi and blood, and cold qi affects circulation of qi and blood. So in chapter 43, if the pain disappears and the patient complains of numbness, it is an indication that cold qi has penetrated deep into the vessels. Very interesting, based on these two chapters, that cause of vasoconstriction being a cause of pain. Again, based on my own experience and observation, patients do have diabetic neuropathy tend to complain about numbness. So again, another interesting observation by the ancient physicians. So in chapter 39 describes that pain, qi and blood flows continuously in the blood vessels, so we have a healthy circulation, and pain is a result of cold qi penetrating, the vessels. So again, description of pain is not that cold qi causes pain, but that's how they would describe the pain, by vasoconstriction. The treatment of pain, very interesting, which I'll be able to overlap with my treatment plan on this case study. Suen chapter 62 and Ling Chu chapter 27 recommends applying a hot compress locally to improve circulation. Now we know that heat might shut off some of the pain fibers and also increase vasodilation to reduce spasms. And most interesting is on Ling Chu chapter 75, to treat cold qi pain with acupuncture in the summer and not on the winter season. So going back thousands of years, one can assume they don't have the comfort level that we have now, living in cold states or countries. We do have central heating. We're able to sleep, on comfortable beds, dry clothes, dry bed sheets. So for us, daily shower or a bath, going back thousands of years ago, they didn't have all those luxuries. So in order to expose your body to such a harsh environment, would actually more damaging than beneficial. So they probably waited until the summertime, once the weather was warmer, to expose their bodies to have treatment. Ling Chu chapter 27 gives a really good description on how to needle on a specific sequence. It states if the pain radiates from above, needle below. If the pain radiates from below, needle above. If you're going to needle into a high irritated area, most likely you're going to increase the pain and cause more discomfort. So this is known as, on biomedical terms, as diffuse noxious inhibitory control, aka pain inhibits pain. So if you want to needle away from the area, which we know as distal acupuncture, would cause the body, the brain to distract, probably with relief of endorphins, blocking the pain level, making the area that is affected probably more tolerable to local needles versus put a needle there, stimulating the strong itchy sensation. It probably would create more inflammation, irritating the tissues, and causing the pain not to come back for more treatments. My research question, my hypothesis was, can acupuncture reduce pain intensity in diabetic neuropathy? And can acupuncture reduce pain frequency in diabetic neuropathy? So these were the two questions I established for my case study. So my Matos section, the patient was male, 73 years old, Caucasian, widow, retired, of course, diabetic, and with an official diagnosis from his primary care with diabetic peripheral neuropathy. The pain intensity on a 0 to 10 scale, 10 being the highest, he described the pain intensity as severe, so 8 out of 10. As often as the pain, 100% of the time, the pain was constant. As far as pain quality, sharp, again, as we notice on the classicals, numbness, achy, and burning. The pain increased with walking, and pain was relieved by changing posture, taking the pressure out of both feet. It affected the quality of living, such as walking, standing, and worse, the first steps in the morning, which was very uncomfortable for the patient. As far as blood pressure, oxygen levels, and temperature, everything was in normal limits, no abnormal findings. I did use a tomography camera, fluoral thermal camera, to have a better, almost like an X-ray version of the temperature of both feet, and we can notice that there is an equal temperature on both feet. Now, ideally, you want to have a constant equal temperature. Has red indicates increased temperature. Bluish will show decreased temperature, as we can see on the extremities, on the toes. The patient had full range of motion as far as his feet. Pain and palpation was not able. He didn't report any pain by palpating the dorsal region, the plantar region of both feet. He was not able to distinguish which toes being pinched. Again, the whole foot was numb. My diagnosis was cold chi affecting the foot. Yangming. Treatment plan was 1 electroacupuncture treatment with infrared lamp 3 times per week for 2 weeks. Then 2 acupuncture treatments per week for 3 weeks. The goal here was to increase circulation, reduce pain, reduce inflammation by warming the Yangming vessel, and improve activities of daily living. I use the description of pain scale, which offers each individual description of the pain level, which is more objective than subjective, because somebody in 8 might be a 3, or somebody comes in with a 10 or 12, from 0 to 10. So I like this. This was a personal choice to use on this case study because it offers a description of each individual pain level. Every time the patient came into my office, he would fill up a soft report form with his demographics and the pain intensity within the 24 hours. He would circle which kind of pain quality he was experiencing, how often did he feel the pain, any change in pain medication over the counter, how long it was authorized by his primary, if his sleep quality improved, and what kind of activities he could do at the moment before, compared to before the acupuncture treatment. On the treatment section, I use electrostimulator, Pantheon Research 4C Pro, infrared lamp, Kias Joy Corpse, infrared 300. On my max section, the points using the stricter guidelines, the points were Lingu, stomach 36, liver 3, Bafang. On Lingu, I used an AIC copper handle needle, 0.25 by 25. The points were needle bilaterally, manually stimulated until Chi was obtained. The needle insertion length was at 75%. The patient was encouraged to dorsiflex and plantar flex until the pain intensity reduced to about 50%. Needle retention was 10 minutes. Afterwards, I would attach the electrostimulator, the clips, the black clip to the left and the red clip to the right at 2 hertz, immediately current continuous mode until the patient report a sensation or so the needle escalating. Needle retention was 15 minutes. Stomach 36, I use an ICU copper handle needle, 0.30 times 40, bilateral perpendicular needle insertion without the G sensation obtained. This was to avoid to increase pain or discomfort on the lower limb. Again, supported by the classics. Needle length 75%. The right clip was attached to stomach 36. The black clip, which I'm going to see afterwards, was attached to liver 3. Frequency was 2 hertz milli current on continuous mode. Intensity until the patient felt a pulsation sensation or I saw a needle for circulation. Total needle retention was 15 minutes. Liver 3, I use, again, same style of needle. The points were needle bilateral, perpendicular, without the G sensation obtained. 75% of the needle length inserted. The black clip was attached on the ipsilateral on the same side of stomach 36. I did not crisscross here. 2 hertz milli current continuous mode. Intensity until the patient felt a pulsation. I observed the circulation. Total needle retention was 15 minutes. Lastly, Bafunk, same type of needle, 0.25 by 25 millimeters, bilateral perpendicular insertion without the G sensation obtained. Because again, I avoid irritating the tissues locally. We already have, there's no electrostimulator on these 2 points because we have 2 master points, stomach 36 and liver 3, which support no one can call the master points of the lower leg and allows the body to produce high levels of endorphins. Total needle retention was 15 minutes. After the needles were inserted, I applied the infrared lamp at 50% of the needle, 50% of the heat lamp intensity. Again, there's numbness. Last thing I want to do is avoid burning the patient. 1, liability. 2, the patient's diabetic. We don't want to create an uncomfortable situation for the patient. It was applied for both feet for 10 minutes. My dependent variables were pain intensity from a 0 to 10 pain scale, pain frequency from a 0 to 100% of the time. I'm just going to have a sip of water. Now let's talk about the results. So the patient had a total of 12 sessions. We can notice there's like a decrease and increase in pain intensity throughout the course of the treatment. We can see there's like a decrease on here, and here as well, and on the last session, but there is a slightly increase from here and from here as well, which we're gonna discuss at the end. But interesting is the pain intensity never reached its original intensity of 8 out of 10. Pain frequency, there were some highs and lows as well. There's like a significant increase between the first and second session. Slightly increase, on the third session, decrease again. There's like a plateau halfway through the treatment course. And lastly, on the 11th session, there was like originally back to 100% and start to decrease again. Again, very interesting to see what happens between these times as far as patient's personal life. After 1 year of treatment, the patient does report a reduction in pain from a 1 out of 10 on a 0 to 10 scale. Pain frequency reduced to up to 25% of the time. And the participant said that I can actually walk longer distance. My feet doesn't bother me. So compare the before and after tomography picture on a few months apart. We can also, on the initial visit, there was like a decreased temperature around the ankle region, and there's decreased temperature on the toe region. Going after several months, there's an equal distribution of temperature here and slightly increased temperature towards the toes. There's more defined versus before. We can notice everything like more bluish. Now we have some green in the middle, which indicates increased temperature. And going to the left foot, again, more noticeable than the right, I would say. There's a decrease here on the first visit. On several months afterwards, there is a more equal distribution of skin temperature, I should say, and as well as the extremities. Now let's talk about the discussions. On the discussion section. Can acupuncture reduce pain intensity and pain frequency? According to the study, yes. Short term and long term, even after 12 months of treatment, the patient still reports improvement. Were there limitations on the studies? Absolutely. Again, this is a single study versus a large group study. But there is a few questions. As a patient walking regime increased because the pain wasn't as bad, he reported there's more pain and frequency, pain intensity, pain frequency. In other words, did the pain increase because he's walking more or just a coincidence? And also because the patient was able to experience more pain, which before was numb. As the numbness went away and the patient's sensations increase, that can be associated with decrease of pain. And lastly, can acupuncture improve blood circulation to the extremities? By looking at the thermography camera, we notice there's an increase of skin temperature. So it'll be interesting to do a larger study and compare patients before and after in long term, see if we can create more evidence that acupuncture can increase blood flow by increasing skin temperature. So this will bring me to my conclusion. Acupuncture can be considered for the treatment of diabetic neuropathy. It can be effective short-term and long-term, which allows the improvement of activity of daily living, which is a very essential component of being active. As any diabetic patients are always encouraged to exercise to help to regulate the blood sugar level. So acupuncture can be a great injunction to diabetic patients by helping them with improve the quality of life, reducing the pain of diabetic neuropathy. Brings me to the end. Well, first of all, to thank my wife Lena, my daughter Bethany, Dr. Robin Sodders, Dr. Gree, Dr. Mark Sodders as being advisors and mentors for my program. Dr. Robin Sodders, a big thank you for encouraging me to apply for this research symposium, to Ron Zaidman and Joanna Zhao. Thank you.
Thank you so much, Dr. Matos. We have a few minutes here. Does anybody have any questions?